Dear Medicos, we are having the honor to have Dr. Aahan Shah with us, rank 2323, double-digit rank. Beta, congrats for this achievement. How you are feeling now?
Thank you. Very nice, sir. Thank you so much.
So, beta, being a fresher, being the first attempt, and you are getting the rank in top 100. So, I will be using this platform to share your strategy. Like you were our foundation student, you joined us in 2020 in DAMS Surat. So, how was the experience, beta? So, let us use this platform to motivate all the students.
Yes, sir. I actually joined from 2019. So my third first was during that year. And just like the trend in my college was DAMS ko karna hi hai, matlab abhi third first mein you have a lot of time and we should invest it for ourselves. So I got this experience of meeting all these faculties from AIIMS Delhi and very reputed colleges, and just sitting in the classes gave me the drive, kept the ball rolling in a way that it inspired me that even I could be at such a place one day, because the faculties were very helpful that way. The drive, the passion, the fire that came through DAMS, that is what I think. And
thanks.
So yes,
thanks for kind words of all the DAMS faculties. So I'll be sharing.
Yes.
Yeah, you continue. What you were saying?
It was from the heart, sir. So that is why I had no issues framing the words. But yes, so I used to use DAMS in third first in a way that I completed ENT, Opthal and PSM third first subjects along with the first and second year subjects by September. And in November or October end, we had prelims. So at that time, I opened my textbooks and I found it very easy to read because my concepts were clear because of the coaching classes. And yes, so third first was a pretty much it set the drive so that I could be relaxed in the later part of my preparation. I won't be too stressed. So yes, starting early is a very, very crucial point, so that you won't get burned out in the later part of your preparation.
So, but like in a third year, like a new final year student, like being a third year student, you were having two options. Because all the third year student listening to you will be taking your words as golden, like you are getting like 2, 3 in the very first attempt. So, but what I want to ask you, like in third year, there was two options. One option was to focus on ENT Opthal PSM with some concentration on the final year subjects. And the second option, which you followed, ENT PSM Opthal with more focus on the basic sciences. So what you will guide all the juniors with?
I think it is very much subjective. This kind of things that I find suitable many people won't find suitable. But in their place, what I would have done would be that I would have just gone over my previous year textbooks or some of my own notes before DAMS coaching classes, so that I would be somewhat oriented when those topics came in that 3 days of period of DAMS classes. After that, it is very necessary to get this visual recall by revising the notes just after the classes, because that will also save time and you won't feel that this is taking too much time and I have some other things to do. So yes, that 3-part strategy is what I used. So I used to brush up my knowledge of that subject before DAMS. In DAMS, that made me oriented to the topics that are asked frequently. And after the DAMS, I would revise its notes in my third first in a day or two. And I would have solved some subject-wise test, if not the full question bank of that subject. So yes, that cycle over a period of 2 or 3 months would be helping a lot in clearing the concepts and getting the visual recall as well.
So, but like you appear for INICET, you appear for NEET examination, what was the role of those basic sciences? Like I'm mainly like if I'm a first year student, I'm listening to you. What is the importance of basic sciences in your Central Institute and NEET examination?
INICET would be a big ball game where the things can be very varying in depths per se. So, but getting your foundation clear and avoiding silly mistakes in that around 50-30-20 ratio of easy, moderate and hard questions, you already have control over 80 questions that way. And avoiding mistakes there has a good grip on your basic sciences as the foundation. So yes, it is very important to vertically integrate this kind of subjects with your final year subjects. And the way that you get this is not just by passive recall of frequent revisions, but by actually solving the questions along with it. So the consistency that way will help a lot. And having a written plan and sticking to the source is the most important thing. That is what I think. Because we tend to feel that मैं अभी ये पढ़ रहा हूँ लेकिन मुझे इसकी जगह ये पढ़ना चाहिए क्योंकि ये बहुत ही important है, इसका chances ज्यादा है. And that feeling will get aggravated a lot more in the end game when you have all the subjects to revise before the exams. So this is kind of my plan before NEETPG exam. After INICET exam, I thought that this would help me a lot. So on Monday, I started with surgery in the morning, then physio-psyche, then Tuesday PSM, Wednesday pharmac. Basically, those subjects that are very volatile should be done in the head part of the day when we are fresh. That is what I feel, and the remaining subjects in the later part of the day. And there is also, sir, what I feel is, to be honest, many people share their strategies on what to read, but most important thing is how to read and how to get that consistency. So I think I would like to speak on that if you have, if I get the permission.
Definitely, but I am most welcome, and why I'm smiling because I appreciate your effort. You're giving nice guidance to all the juniors. Okay, with this way, I plan the schedule, and that's great, beta. And I always appreciate. I always, even in my lecture, I say I love Gujarat students because you are most dedicated students, beta. That's why we are getting awesome results from your colleges across the whole state. So, beta, I appreciate your effort, and you have the full permission, beta. You can discuss each and every point because I want every medical should use the platform to get the guidance how we have to proceed. But before that, I just want to ask one thing. How's the experience of that classroom learning, beta? Like you're discussing, you're telling the whole plan for the juniors. Where was the role of classroom learning in that strategy?
Yes, sir. So as I said, because coming in third first, we feel that this is the golden period of 6 or 7 months, and we tend to not waste, but focus on some different priorities than our own self. So getting into DAMS live classes, sitting there for this 3 days of that roller coaster journey of getting into the orientation of the subject is very, very helpful in a way that you get the idea, you get the drive, you get the passion. So that is very, very important to get that momentum, because without that, you will feel burned out a lot in the later part. So I think, sir, it can be divided in 2 parts, the what to do part and the how to do part. So what to do part would be passive plus active memory should be used. So passive would be frequent revisions. 3 revisions of whatever source a student finds convenient is the way to go. Whatever is good to him subjectively, I think that would be the best thing. But once you choose it, let's say if I am sticking that medicine is a very beautifully covered subject in DAMS. So I would use my this medicine in DAMS in such a way that I use it thoroughly through its DAMS question bank, through its DVT, through its DQB, and its subject-wise tests. So that will give me this sense of completion, and it is very much in the long run that yes, I've completed this subject once, twice, or thrice. So sticking to the source and having the written plan is, I think, the most important thing in the what to do part. The second would be at least 3 revisions of each subject. And in the how to do part, I'm covering that how can you read thoroughly through very volatile subjects. So 3 revisions is the must in either phase. So whether you be in internship or final year or pre-final year. And to implement this compound effect in grant. So I made a book of wrong questions. I had the habit of writing this 50 questions out of 70 questions. Let's say this 50 questions in such a way that I got this wrong and this is how the actual approach is. And having written this 50 questions, all the DAMS tests and any other platform tests, they cover this test in such a way that it is according to the NB exam sphere. So the topics are the same, the question may vary, and having this list and revising this list again and again before every mock test would give me around 500 very important topics which have a very high probability of getting into exams, and they are customized as per my weaknesses in my subjects. So around 5 or 6 questions were such that they gave me an edge in NEETPG exam. Reading this list of around 400 topics before NEETPG exam, above and over my revisions, I could eliminate many options in my NEETPG paper by revising this volatile topics and weak topics list of grant test wrong questions. So I think this is just an approach, but having such an approach that gives you long-term benefits in this way would be very good. So there is also the concept of 28 subject notebook. Many of my colleagues did that. I chose this wrong question notebook. So that would be the second priority. The first one would be having the written plan and sticking to your source. And the second would be frequent revisions with getting this compound effect in mock tests. Third would be, I think, solving many questions because they improve your exam taking ability, which is the deciding factor, I think. Even the rank 30th and rank 3000 have read their subjects 3 times. But what differentiates them is that exam taking ability. So the one who is getting rank 30 is not making any silly mistakes, and he can rule out options and he can reduce the conflict between 2 confusing options. And the basis of that lies in having a clear concept, but as well as having that time and again solving questions, getting that exam taking ability by actively solving questions, and plus the visual recall would be enhanced. So suppose let's say I'm solving this question. Now I know that from this topic, the questions are asked in this manner. And the next time when I revise that same topic, I would have that insight that helps me in getting that point strengthened. So this kind of minor things actually matter a lot in the long run, which I realized very late. I made that list in January to April this year, but I sincerely wish that any of the person watching this video get the benefit of learning from my mistake and implementing this very early on in his or her preparation. So I think that is the what to do part. And the second would be the how to do part. So the how to do part would be divided in 3 subtopics, and that would be the discipline, the reading skill, and the MCQ approach. So there is this TED talk by Jordan Harry, where he explains about good reading habits, the 3 division strategy of skimming, scanning, and speed reading, which is what I used. So let's say I'm reading this subject, I want this done in 1 day. So in the first 45 minutes, I use the Pomodoro approach of using a timer and having a time conscious use. So that is also very important. So in the first 45 minutes, I read the in-text, I read the rear cover, and I just skimmed through the images, the topic names in this first 45 minutes. I would go to library at 8 a.m. and then in the morning period of 4 hours, I would go from skimming to scanning. So in scanning, I would focus on images now, as well as subtopics and some highlighted points in that subject. So by the time after lunch, when I'm going for my third read, I have that subjective confidence that I know I have read the subject twice now. whereas I would have just finished around 1/4 or 1/5, let's say, if I would have started by the conventional pattern. I know that after बहुत ही important table आ रहा है, so I would not get fixated on any particular very volatile and less yielding table in my reading, and that knowledge would keep me pushing and keep me going. So the bad habits of regression, that is going to the first line again after reading a page, the bad habits of fixating on to a particular line, this kind of habits can be overcome by implementing this kind of things, having an optimum environment, listening to classical music or music without lyrics. This kind of things can help a lot in reading. And so Pomodoro, so 45 minutes of studying and then the next 5 minutes that are very important. So we have covered the reading part. My friends, you can watch this Jordan Harry TED Talk on YouTube. It is a very beautiful video. He shares very interesting insights and I think it will help you a lot. And the second would be the discipline, which is the most important. So when you are having your break, we have this very silly sense of definition of break that I need to watch this Amazon Prime episode or any kind of thing that is actually disintegrating your studies. You feel that let's scroll through this social media, let's scroll through this chat in my break. But that is giving you instant gratification, and that gratification will be very strong when you are studying and you come across genetics and pathology or drugs and pharmacology. You would feel like isse acha to main wapas phone khol leta hu. That is a subconscious thing, and it is very important to avoid that. So what I did was I used to read this Robin Sharma's 5 a.m. Club. Being a morning person, this suited me very well in my reading and my implementation. So I used to read this book in that 5-minute break. Another great book would be Atomic Habits by James Clear. Many of you might have heard about it. It talks about 2-minute rule, minor changes over long term giving benefits, and real examples of Olympists, CEOs, business entrepreneurs. So I think either of this book in your reading or listening to some very good podcasts. So I used to listen to some stoicism based podcasts in that break. And believe me, your productivity will increase twice or thrice if you listen to or read this kind of things and then you go back to your studies, listen to this kind of things in break and then you go back to your studies, instead of decreasing by 1/2 or 1/3 if you would have used your social media, because you get this urge, it is a positive and vicious cycle. It is what I think. So that is the most important part of discipline.
I'm loving.
And the third would be,
I'm just loving the session, Beta. The way you are explaining all the minute points, which we have learned after teaching for last 15, 20 years, that at such a young age, you are explaining so nicely, so beautifully, Beta. Hats off to you. Apart from getting this rank in top 100,
thank you so much, sir, for your kind words.
Yeah, I appreciate the way you are explaining all these things, which will increase your output, in half an hour, you are wasting your time on the social media. Damn sure after that half an hour you cannot concentrate to that extent which is required.
Yes.
Getting the real. Very nicely, beautifully explained, Beta. Yes. Now you are using a word again and again, discipline. So Beta, like the discipline we follow in the live lectures on eMedicoz, like we have multiple options of the required, but like in the live session, how you differentiate like live session going on, what role discipline play there?
Yes, sir. So let's say this is the third day of DAMS coaching and this is the evening part, and we feel that अब तो Sunday है, अब थोड़ा अभी घर जाते हैं जल्दी, थोड़ा खाना खाना है. But if you think about this in such a way that every topic or every case is a person who may come to you in your future, irrespective of your branch, and he asks you for help. So being a doctor, we should not be in the position to say that I don't know how to tell you or how to refer to you to some better person, because I am not aware of this thing that's ailing you. So I used to remember this thing actively again and again when I used to feel that my attention span is going out and I can't focus on the topics displayed. And having this image of a patient coming with this disease made me focus on that topic again. So that helped me through some times when in live classes I used to feel that yes, I am not able to focus.
That's great. Again, your each and every advice you are giving is like sort of a different view you are presenting. Like if I'm exhausted and I'm just taking it as a patient, then I can't refuse the patient. I can't say the patient.
Yes, yes.
ये नहीं बोल सकता कि I was sitting in the evening, I couldn't concentrate, I couldn't treat you. Very nicely taking the things better. Now coming on
Thank you so much.
Coming on the T&D beta, like in the internship, you joined the test and discussion on the eMedicoz. How was the experience of those live T&D? Like if I'm taking you on the quality of the MCQ, you attempted in the T&D against NEET MCQs.
Hello, am I audible?
Yeah, you're audible.
Yes, yes. Test and discussion. Test and discussion, I think, the concept is same in such a way that the faculties who have been teaching for the past 20 years are covering the topics, especially based on the last 3 years papers, and in such a way that it is a topic which is very high yield because it has been asked in the previous 2 years. Even sir, this time I think they did not disclose the answer key, stating the fact that we have a very limited amount of information from which we can ask the questions. So that is, I think, the reason they mentioned for not giving answer key or exam recall. So just focusing on the previous year topics, which are covered in test and discussions, which are covered in your recall sessions. So would give you around 60 to 70% of yield in the upcoming NEET or next exams, because the topics will remain the same, the topics and not the questions. So getting them strong by this kind of approach would be a very high yield fact, considering that the active part of memory is also being used because you are solving the test before and then discussing that topic.
That's very true, beta. So now, like after attempting all the T&Ds, you appear for CBT. How was the experience of live sessions of CBT, beta? Like how those sessions played the role in your success journey of this rank 23?
Sir, I felt that the INICET exam was basically just very similar to DAMS CBT exam. So it was very mimicking to that, because the level of difficulty was pretty difficult as mentioned in the paper PDF, and even INICET was very difficult. There are topics which we were not exposed to, and that was affecting the topics that we actually knew and which we actually had the concepts about. I had that silly notion that हाँ ये डिफिकल्ट क्वेश्चन में ऐसे थोड़ा कंफ्यूज कर रहा है तो इसमें भी शायद मुझे अभी आइडिया नहीं है तो ऐसा कर सकते हैं. सो दैट इज द वे दैट वी मेक सिली मिस्टेक्स. एंड इन फैक्चुअल क्वेश्चंस just after reading 3 lines or so, we have this instinct of हाँ ये option D होगा, right? And if we take that particular option, especially after 3 rounds of revision, then in 60 to 70% of the cases it would be true. Even after my 4 or 5 revisions, I could not get the this ability used completely. But I think going on and on about implementing this after revisions would give a great edge in getting those silly mistakes correct. And in conceptual questions, it is actually the reverse approach, because we miss on markers in long stem questions. For instance, in this NEETPG exam, there was this obs and gynae question where classical CS was mentioned interspersed, and there was this history of classical CS mentioned interspersed, and the question was about breech delivery at present. So I think majority of the students marked external cephalic version at 36 weeks. But the classical CS history marker, if read correctly in your second or third reading, because it is a conceptual question, would give you that insight. Nahi, isme D is not the option because classical CS hai to elective CS karna padega abhi next week mein. So that is how conceptual questions can get correct after 2 or 3 readings, and factual questions should be approached in a manner that you go with your gut instinct. So I think that is what I have learned in my long-term journey. And that covers up the how to do part and the what to do part. So that is, I think, the drill, and going through the burnout, going through the phases of volatile topics in which are there in almost every subject to some extent. The consistency established by positive habits is the main thing that will keep you going, that will keep your passion and fire fueling. So I also used to have this habit, which I think helped me a lot to stay consistent, that I used to exercise in the morning after 1.5 hours or so of reading. And when I would be having that endorphin surge, having that अब कुछ भी हो जाए, rank बुरा भी आ जाए तो चलेगा मुझे. In that moment, I used to convey this simple chant of I am grateful that I have a roof over my head, I have clothes to wear, and I have food to eat. I am grateful that I have a very strong family support. I have good mentors. And just saying that would give you a positive feeling, would increase your communication and bonding with your parents, and will give you a great positive feedback in your studies. So personally, I felt that it was a very crucial fuel for my consistency.
Myself, I'm learning many things on this platform. The way you are explaining all the points, beta, these are the required, apart from the academic, like we are revising multiple times. Small things matter a lot, beta. These small things matter a lot. Because many students I have seen, they quit in the last spell. Before, like in the last spell, they will quit the game. But if you go with these small things and you take more, like special care for your mental health, it helps a lot, beta. Now, coming on the last session, we came with the integrated platform, like we came with the integrated session of DVT, integrated session of all the topics. So like the new pattern, like we are moving from the NEET to next. So what was the role of those integrated sessions you must have watched on the eMedicoz, like grand rounds or all the integrated sessions of micro with the medicine?
Integration is very good if any student is able to do it by himself or herself. But the faculties that are teaching you, they are in this field for 20 years. They have this vast amount of experience. They have the idea of what kind of topics are asked. So you will definitely get an edge by going to these sessions or implementing these sessions, making notes of these sessions. And there would be, it is basically NEETPG is the game where you have to connect the dots for your for these topics to imprint in your brain, and who would be a better source for it rather than this kind of sessions of DPT or any other things where you are also revising all the 19 subjects in a very short span of 7 days just before exam, covering the volatile topics, getting that visual recall if you have used DAMS thoroughly. So these things matter a lot, especially in the long game. Before INICET, I did not have that kind of discipline. I did not have that kind of written plan. And I just implemented those things in the end. I revised my notes thoroughly again and again and again. I read around 2,000 pages the day before by that scanning method of Jordan Harry. And yes, I think if you believe it, you can do it. You just need to stay consistent till the end. Till the end. You don't need to have that kind of justification कि हाँ बहुत पढ़ लिया, आप थोड़ा exam आ रही है, थोड़ा relax हो जाता है. Because people around you have this huge fire of scoring good in their exams, and that may overtake you, which happened with me in INICET. I got rank 231 there, and then I worked very hard so that I could feel that self-satisfaction, and I'm grateful that I had that experience. So I'm not regretting even INICET thing. No.
Nothing to regret, beta. You are getting this top rank,
yes.
Single digit rank, beta. This is an awesome achievement. At the last, beta, any special message for your family, followed by DAMS family?
For my family, I think that I just want to say the same thing, sir, that I am actually grateful to my mom that in the end that she not just my mom, my brother, my dad, my grandparents, they all supported me in one way or another. And it is not just my effort, it is an effort from all 6 of us that I am standing here having this conversation. So yes, I am grateful, and I hope that I can repay that their debt, even if it takes a lifetime of it. So, and DAMS family, I think, sir, the same thing, that the enlightenment of fire, the idea that yes, this can be done, the realization of that potential, which is happening not just to me, but to all the students pan India, attending the live sessions, getting inspired. I still remember Dr. Siddharth sir's, we had to turn these flashlights on, and at that end we had this beautiful experience on the stage, his rap sessions, and all of that. It totally increases your concepts. It gives you this satisfaction of completing the subject. So I think it wouldn't have possible for me if not for this both of my families.
Thank you, Beta. Thanks for kind words. We are proud to have Dr. Aahan from DAMS Surat. And I appreciate, Beta, the way you explain each and every point. I request all the medicos listening to you across the country, okay, please follow these small things which play very important, very vital role in the success journey. So, Beta, thanks a lot for coming on this platform and sharing your success journey. And I'm confident the way you are taking these things, you will better excel in the upcoming years, and we wish you, on the behalf of DAMS family, we wish you very best of luck. Thank you. Thanks a lot.
Thank you so much, sir, for your kind words again. I feel very happy at the end of this session that I had an opportunity to talk with you, sir. So very grateful, sir. Thank you so much.
Thank you, Beta. Thanks a lot.